Hello everyone, my name is Derek Tran. I work as a senior exercise physiologist at the Department of Cardiology, Royal Prince Alfred Hospital, with the Congenital Heart Service. I also teach exercise physiology units at the University of Sydney in both the undergraduate and postgraduate programs. At this year's Fontan Education Day, I presented with Dr. Rachel Cordina about the effects of exercise training in the Fontan circulation. And after the presentation, members of the ANZFAC committee approached me to see if I was willing to do a Q&A about exercise physiology in those with a single ventricle circulation. And it was really exciting to see the amount of questions that we did get in. And I hope over the next few videos, I could address some of those questions and provide you with an insight about exercise physiology in the Fontan circulation. So these next few questions are about my role in connection with the congenital heart disease and Fontan community. The first question is, what does an exercise physiologist do? And how are they different to a normal physiologist? And that's a really good question because not many people know what an exercise physiologist does because we are still a relatively new allied health professional. So the best way I think I could explain it is an exercise physiologist attempts to use exercise as a form of medicine. So we use exercise as a therapy to treat and manage people living with chronic health conditions to try and improve prognosis and health outcomes. And how this is different to a normal physiologist is a normal physiologist will focus on all aspects of the human body, its anatomy, its function and biology, while an exercise physiologist purely focuses on exercise testing, prescription and response in people living with chronic health conditions. So I think that's the difference there. Where did you study and how long was the course? I studied at the University of Sydney. It was a 4-year-long bachelor's undergraduate degree. In addition to the coursework, we actually had to do in excess of 500 hours of clinical placement. And what that means is we visited a variety of clinics and hospitals throughout our course to get hands-on experience with people who are living with chronic health conditions. And this can include diabetes, cancer, or people living with complex heart conditions such as congenital heart disease. But you can also study exercise physiology as a postgraduate in a postgraduate program. So a master's in exercise physiology normally takes 1.5 to 2 years, but you'll also have to do those clinical hours within those 2 years as well. So the third question is, what attracted you to work as an exercise physiologist in the setting of congenital heart disease? So I was always interested in cardiovascular disease and exercise. And then I met Dr. Rachel Cordina, who introduced me to research in pulmonary hypertension and congenital heart disease. And then my interests just began to grow from there as I continued to do research and work with the congenital heart disease community. The next few questions are all about research. So the first one is, what was the research you were involved in with the Fontan Registry? Well, I was actually involved in 2 main areas with the Fontan Registry. One had to do with body composition, and the other main area I focused on was looking into exercise capacity. So what we did with our body composition project was we aimed to investigate and characterize the body composition profile of people living with a Fontan circulation. We did this by doing something called a DEXA. So it's a special scan that can tell us the amount of bone you have, the amount of muscle you have, the amount of fat you have. So it gives us a really good detailed picture of body composition in the human body. The second project we looked at was exercise capacity. And what we mean by exercise capacity is essentially how fit you are. And we would test that using a cardiopulmonary exercise test, where you kind of wear a mask or a scuba-like mouthpiece, and then we get you to exercise as hard as you possibly can. And during that test, you'll be breathing in and out some gases, and we collect those gases and analyze them. And the main thing that reflects exercise capacity is something we call peak VO2, or peak oxygen uptake. So in general, when we refer to exercise capacity, that's what we're referring to, is the highest amount of oxygen that your body can actually utilize. In our exercise capacity projects, we looked at 2 key kind of sub-projects. One was to do with the trajectory of exercise capacity, or over time, does your exercise capacity increase or decrease, or does it remain stable? And then the other project was looking at a subset of people who had normal or supernormal exercise capacity, which is quite impressive for people with a Fontan circulation. So what were the findings? So our main finding in the body composition project had to do with the fact that people with a Fontan circulation do tend to have low muscle mass and high fat mass. And low muscle mass becomes a really important thing we have identified because of its implications for exercise capacity. We know that lower limb muscle mass acts as a second pump to push blood back towards the heart. And that in turn results in better exercise capacity. In addition to that, we did find higher fat mass compared to the general population in a lot of people with Fontan circulation. And what makes that finding quite unique, I guess, is it means young people who are put onto a scale, although they weigh relatively normal, it doesn't truly reflect their body composition because the lower muscle mass kind of conceals the increased amount of fat that someone does have. So that was our main finding there. In our exercise capacity project, we found that people with a Fontan circulation actually had a stable exercise capacity over time. So over half of the people in that study actually were able to increase their exercise capacity. Whereas normally in the scientific literature, we found that most studies have recorded that exercise capacity does progressively decline. So that's quite a unique finding. In our last project, we looked at and identified those people who did have normal or supernormal exercise capacity. And we found that in that group, there were a whole range of cardiac characteristics. So different Fontan, different ventricles, different types of Fontan circulations. Some people had pacemakers. So there's a whole range of characteristics, and there wasn't particularly a set kind of type of heart that you need to have normal exercise capacity. And what surprised me most, I think that last project where we did look at that subset, it is quite interesting that a whole range of people can achieve normal or supernormal exercise capacity. And a common finding we found in those people was physical activity. So those who did have a normal or supernormal exercise capacity tended to be more physically active as a child. That seems to have really important implications as adults. So this next section is all about general exercise recommendations in people living with a Fontan circulation. So the first one is, how can we determine safe levels of exercise for individuals living with a Fontan circulation? So where I'll refer you to is actually the CZAN's guidelines, or our progress in cardiovascular disease recommendations. And how we would actually guide a safe level of intensity is by evaluating multiple clinical factors, so we can individualize exercise prescription. So what we'll look at is how well your heart pumps, the integrity of your aorta, so the big vessel that pumps blood out of the heart, whether there's any obstruction of any pathways, if your valves are leaky or if they're narrower, and whether you have any arrhythmias or previously had arrhythmias. And based on these factors, you'll be given a risk classification, and then we will suggest a recommended level of intensity for you to exercise at. I should note again that these are recommendations, and your cardiologist may advise you that you can exercise at higher intensities or lower intensities, and they will know your anatomy best and will be the most appropriate person to give you advice on that. So this question is, in your presentation at the Fontan Education Day, you referred to aerobic exercise intensity. Can you please talk us through what this means and how it might be applied? So in the simplest form, exercise intensity is how hard you are working. So how hard are you working to perform that work rate or level of exercise. So what we can do is use simple and practical methods to estimate exercise intensity. And one of those ways is to use something called a ratings of perceived exertion scale. Many of you may have seen this before when you have done your exercise test, but essentially it's a scale from 6 to 20, or some scales will be 0 to 10. And each number will reflect a certain perception of effort. So if we're near a 9 or a 10, we consider that as very light. So you feel like you're doing very light exercise. And what we can use is these numbers to actually estimate the level of effort that you're working at. So the really important anchor points using this scale is most people want to exercise at a moderate intensity. So that's between 11 and 13. And the way we can know we're working at a moderate intensity is using something called the talk test, which is essentially a level of exercise where you can still maintain a conversation uninterrupted. So essentially you can talk but not sing. How we define or how we know we're going above moderate intensity to vigorous intensity is by, again, the talk test. Essentially, if we can't maintain a conversation uninterrupted, we've moved into the vigorous intensity category. So the talk test is a very useful tool to help us anchor the scale, as well as something we could use to differentiate between moderate and vigorous intensity. So aerobic exercise prescription for adolescents and adults came up in your presentation. What does this mean, and how does it apply to general recommendations for people with a Fontan circulation? So this table here is the recommendations for people living with congenital heart disease. So again, it will depend on what risk classification or category you are in, based on those factors from that previous slide. And that will again determine the level of intensity that we would recommend you work at.